Hi, can General Hara or Dr. Char comment on the veterans home in Hilo? What did the state regulators find and recommend when they inspected Yukio, and what's being done for residents now, since yesterday's effort to move some of them was unsuccessful because other facilities could not take them in?
Clearly, the Yukio Okutsu Veterans Home has been a concern of ours. We did send in a quality assurance team from the state for several days last week, and they did a top to bottom review of procedures and policies. In addition, as you are aware, Senator Schatz had made a request to the Veterans Administration, and they had jointly sent with the state Dr. Yasawa, who was on site at the facility for a couple days, reviewing policies and procedures with the staff so that we could assure that they were implementing the best practices for infection disease and containment of the COVID virus. And General Hara can provide you an update.
So besides the team that we sent to the Big Island to do the assessment, we put in a request for assistance, and we're receiving about 20 healthcare specialists. These will be nurses specialized in infection control, employee health, and then other specialties, for example, safety and industrial hygiene, housekeeping, and logistics. So we expect them to arrive tomorrow and then start the transition of assisting that Yukio Okutsu Veteran Long-Term Care Home. Thank you.
Yeah, and certainly, Josh, you can add. I'm not aware of when the Veterans Administration would be making their report available. We can check on that and get back to you specifically. In terms of when the deaths are counted, there is a very specific protocol for confirming when someone dies, whether it is due to COVID or not. And we do announce the statistics as soon as the state of Hawaii receives that report. As in many instances, even for individuals just becoming COVID positive, the individual is informed first, and we do inform the public once we become aware. But oftentimes, because of social media and because the individuals have the information ahead of when we officially get notified, there is a lag in the reporting of the data.
Lieutenant Governor, did you have anything to add? Go ahead.
Yes, I can add that. So I've read the preliminary report, and I think we'll spare Director Char on this one for today because she is in day one, although very familiar, of course, with this challenge. The heartbreak there is monumental, of course, and this is what sadly we've seen all across the country. When institutions of any kind have outbreaks, they spread rapidly through an institution because of close proximity of people. We saw that in our prison, and of course we saw it over at the veterans nursing home. It's also happened in every other state. The challenge, of course, is that we see fatalities at a high rate because, and this is from the report, the age of the individuals in question that got sick, some of whom died, they're very old. Almost all of them had very severe underlying conditions, and that is not to make an excuse in any way whatsoever, but it is the reason that it happens. And I can tell you, if I put my physician hat on, a lot of the individuals, God bless them, had made choices to not, under any circumstance, whether they got sick with pneumonia or COVID or heart attack or heart challenges, they were not going to ask to have life-sustaining life support systems like breathing tubes, ventilators. And so that's why you do see a very high mortality rate amongst kupuna. The mortality rate, if people don't have underlying health problems, is over 14%. When you add to that other underlying health problems, it's very high. So Dr. Char and I can definitely get you a lot more details in the coming days, but we are trying to be respectful of the process. And I should put in a plug for Dr. Al Yazawa. He's a geriatric specialist, also a colonel, if I'm not mistaken, in the military. And he's doing excellent work for the state, trying to help the circumstance forward.